Welcome back, everyone. Flu season doesn't take off during the holidays. In fact, several risk factors increase when we are getting together to share that holiday cheer.
Dr. Leslie Sizemore is a physician with the SouthCoast Health Family Care Practice, and she's joining us with some tips for avoiding the flu in the new year. This is definitely a topic we circle back every single year. We try to figure out how we can get away from it. And what do you have for us today? I mean, holidays?
Well, you know, holidays, obviously you're getting together in larger groups, and some of the things about the flu are you can actually be contagious with the flu 24 hours before your symptoms start. So a lot of times that's how people are giving it to other people. They're not doing it on purpose. It's because they didn't even know that they had it yet. So, you know, flu is spread by a droplet, meaning sneezing, coughing, talking, anything that has liquid associated to it. That's how you're spreading the flu. So in a large room of a bunch of people laughing and talking, you're going to be able to spread it very easily. So one of the best ways to prevent it is obviously the flu vaccine. This vaccine is made to help prevent the disease from even starting in the first place, so how are you going to spread it if you don't have it?
We were talking earlier, and of course you remind me Colorado is right up there with Georgia, but what is it about Georgia, and I don't mean to make light, do we not wash our hands enough here in Georgia and South Carolina?
You know, it just...
What is it? And let me specify that Georgia and South Carolina, Georgia and Colorado are the worst states hit by the flu this year. South Carolina is right behind them.
Right. So if you go to the CDC and pull up the map of how prevalent the flu is right now, Georgia and Colorado are black. So we are the worst in the nation right now.
That's not good.
Some of it has to do with the strains in that area, because strains can typically be different depending on what area you're in, since we have hundreds of strains of influenza. And some of it is vaccination rates. And so I couldn't find the exact data on vaccination rates for Georgia right now. But if we're not getting our vaccinations, then we're going to have higher rates of the flu in that area. And so that could be a big part of it. But you know, it's not something I think that people are doing wrong in particular. I think it's the strains that we have in our area, and right now it's influenza A that's predominant, and it started really ramping up the end of November, beginning of December.
It's really interesting, though, that you say hand washing, because when you think about the holidays, I don't think not enough hand washing. I think a lot of appetizers and cookies, and everybody's touching the same plates, and like you said, kind of talking really close with everybody. So that's kind of what I think when I think of sharing the germs. So, and like you said, 24 hours before is when you can start spreading.
Right.
It can really just wipe out a family in terms of healthy to everyone's got the flu within a matter of days. So,
and it's a cycle of it. So one gets it, and then the next one starts in a couple of days, and the next one starts in a couple of days. So you've got this 10 to 15 day span of, you know, basically being contagious to other groups.
Absolutely. And so kind of what are your tips other than the flu vaccine? People can still get the vaccine, right?
We recommend it through February, March, because our flu season goes pretty much, there's no season for the flu. You can get the flu any time of year, but we see the highest rates from December through March. December, January, February being our highest peak. So we're just now getting into that peak. So definitely still can protect yourself from the flu at this point, but good hand washing. And then, you know, knowing when to stay home and stay away from people. I think a lot of times people feel like they can't miss work. They want their kids to go to school anyway because they're worried about them missing work in school or how many days they're going to miss from school. So they're trying to push them to get back into those activities when they're actually still contagious. So really, you know, staying out of those social environments when you know that you're having symptoms, and then also treating. So if one person has the flu in the household, the other family members can be treated with Tamiflu or antivirals to protect from that, and then that's going to help them from getting it and spreading it to their classmates or coworkers or whoever as well.
The flu shot helps lessen, correct? I mean,
it does multiple things. So it can prevent the flu. It helps decrease hospitalizations. It helps decrease the duration of the flu activity. And then it also helps protect other people from getting the flu because you start to get a herd immunity against the flu as well.
We got our flu shots here this year.
I was late getting on board. I've been doing it about 3 years, so I confess, but I'm on board.
I got my first flu shot this year, so I'm definitely good to go. I'm ready.
Every individual person makes a difference who gets it. So the more people we can get to vaccinate, the better, because that's protecting you and your family.
And we must remind people, it is a guessing game, because you've got to come up with the flu vaccine a year or two in advance. So it's a guessing game as to what's going to be out there.
They look at the strains that were most predominant from the year before and engineer the vaccine based off of that. But it is a educated guess.
Well, so far things going well. Okay.
Yeah, here we
Yes.
are.
All right. Thank you so much for joining us.
Thank
you so much.
Today. All right. When we return, we'll check in with the Humane Society when we come back, and there's a lot going on right now out at Sally Mood Drive. That after the break.